Hello everyone, this is Nilanjana coming to you with a video on period problems. I'm coming to you after a little bit of a long gap, but I hope you're all keeping well. I've been a doctor for the last 25 years and a GP for the last 20, and I'm trying to simplify the complex problem of period issues, and I've tried to do this by asking some questions, and hopefully this will become very clear. If it doesn't become clear, or if you have any questions, please put all your questions in the comment box and I'll be very happy to respond to them. Why do we get periods? So the blood we see during a period is because of the breakdown of the wall of the uterus. The wall of the uterus has been building up in anticipation of a fertilized ovum settling on the wall of the uterus and then growing into a fetus and a baby. So if this does not happen, then at the end of the month the uterus wall breaks off and is moved outside of the body. We see it as a period, and then after the period the uterine wall starts building again, preparing for the next month if there is a pregnancy. So this is the reason we get periods. When do we get periods? This is not an easy one, because over the last few decades we have seen the age at which girls or women get periods come sooner and sooner. So around 30 years ago it was quite normal or average to start periods at the age of 12 or 13. At present, we see girls who start having periods at age 8 or age 9. This might be to do with our diet, with all the chemicals we consume, etc. But the fact is that the age that we start periods is coming forward all the time. How often should the period come and how long should it last? On average, the period should come every month. Now, when we say every month, that can be any time between 21 to 32 days. So the definition of a monthly period is quite varied in that case. How long should the period last? The period can last anything from 3 to 10 days. So how long does the period last and how often does it come is spoken of as monthly, but this has wide variations in patients, and it is a very important topic to discuss when you're seeing the doctor. I would recommend everyone with period problems to download the Menstrual Diary app and to record all your dates over the last 3 or 4 months of when you started and when you finished your periods, so that when the doctor looks at the date, he or she has a fair idea how frequent, how infrequent, or when exactly are the dates of your periods. So that makes life a lot easier. If we are going to check for things like ovulation, etc., then we will know when to time the blood test. If you just say, oh, I know all my dates, then that is not very useful, because then we cannot calculate the dates according to the tests that we need. Periods can be heavy and periods can be light. This again is a very, very subjective phenomenon. So for some people, heavy periods mean that they cannot go out of the house, they cannot work, they get severe stomach cramps and headache, and they have to stay indoors with a hot water bottle and take tablets to reduce the bleeding. For other people, heavy periods just mean using more sanitary pads and they can go about their work or their school as normal. Light periods mean spotting generally, but I think it is important to ask and to discuss with your doctor what exactly you mean by heavy periods or by light periods. The other important factor in this is to mention that most young girls and most young women have a bit of pain before the period starts. Once the period starts, say on day 1 or day 2 of the cycle, there should be no further pain. If there is pain throughout the period, then this is not normal, and then this needs looking into. If there is pain before the start of the period, that is fine, that is expected. But if there is pain once the period has settled and throughout the period, then that needs medical help. Why do people go on the pill? Because without the pill, there is a high chance of getting pregnant, and people or young women do not want to get pregnant at times that they are pursuing a career or they are in some other way not ready to have a baby. So the pill is composed of hormones that we give to the patient. The patient takes this as planned, and these hormones that are inside the tablet, they override the hormones that are released from the brain. And the period that we get on a hormone or a pill is called a withdrawal bleed. It's an artificial period. It is not a real period. So these are the bare bones of periods. There are different kinds of pill that you can choose depending on your body weight, whether you smoke or not, whether there's family history of cancers or not, etc., which you need to discuss with your doctor before starting on the pill. If you have any further questions about period issues, and I'm sure there will be many other questions, please feel free to comment and ask the questions in the comment box, and I will try my very best to answer them straight away. Thank you for watching and take care until my next video. Bye now.